PSC NURSE പുതിയ വീഡിയോയിലേക്ക് സ്വാഗതം. മെഡിക്കൽ സർജിക്കൽ നഴ്സിംഗ് എൻഡോക്രൈനോളജി പാർട്ട് 2 വീഡിയോ. 50 ചോദ്യങ്ങളും അവയുടെ ഉത്തരങ്ങളും ഈ വീഡിയോയിൽ ഉൾപ്പെടുത്തിയിരിക്കുന്നു. വീഡിയോ കാണുന്നവർ ചാനൽ സബ്സ്ക്രൈബ് ചെയ്യുവാൻ ശ്രമിക്കുകയും ഫ്രണ്ട്സിന് ഷെയർ ചെയ്യുകയും ചെയ്യുക. നിങ്ങളുടെ വിലയേറിയ അഭിപ്രായങ്ങളും നിർദ്ദേശങ്ങളും കമൻറ്റ് ബോക്സിൽ രേഖപ്പെടുത്തുക. വീഡിയോ ഇഷ്ടപ്പെടുന്ന ലൈക്ക് ചെയ്യുകയും അല്ലാത്തവർ ഡിസ്ലൈക്ക് ചെയ്യുകയും ചെയ്യുക. നമുക്ക് വീഡിയോയിലേക്ക് കടക്കാം. Excessive thirst is called polydipsia. Excessive appetite is called polyphagia. Inflammation of the tongue is dash glossitis. Excessive swallowing of air is dash aerophagic belching. Heartburn is called pyrosis. Fatty foul smelling stool is called dash steatorrhea. Area of hypopigmentation or white patch on the skin is called vitiligo. Adult hypothyroidism is called myxedema. Abnormal growth of body due to overactivity of anterior lobe of pituitary gland is dash gigantism. State of being short in nature is dash dwarfism. Fluid accumulation in peritoneal cavity is dash ascites. Dash is calculated by measuring the amount of oxygen the body consumes when it's in a state of complete physical and mental relaxation. Basal metabolic rate or BMR. Peritoneal tapping of fluid is called dash paracentesis. Enlargement of the thyroid gland which results due to lack of iodine dash Goitre. Swishing sound indicating vascular turbulence is dash bruit. A grafting sound heard with the respiratory ventilation is dash friction rub. Dash are metabolites of the hormone produced by adrenal cortex ketosteroids. Dash means that the thyroid glands are functioning normally. Euthyroidism. Dash goitre is not caused principally by nutritional iodine deficiency. Endemic. Dash goitre is not restricted to any geographical area. Sporadic. Goitre producing agents that inhibits thyroxine T4 production is dash goitrogens. Dash is a deficiency of thyroid hormone resulting in slowed body metabolism, decreased heat production and decreased oxygen consumption by the tissues. Hypothyroidism. Dash thyroidism develops when there is insufficient stimulation of a normal thyroid glands. TSH levels are decreased. Secondary hypothyroidism. Dash hypothyroidism develops if the hypothalamus cannot produce TRH and subsequently does not stimulate the pituitary to secrete TSH. Tertiary or central hypothyroidism. Dash is defined as hypothyroidism that is diagnosed with an elevated TSH level but a low normal T4 level. Subclinical hypothyroidism. Hormone that regulates calcium metabolism is parathormone. Mucinous edema is dash. Myxedema. Condition caused by hypothyroidism marked by mucoid infiltration of skin, edematous swelling on face, lymph and dry and rough skin, loss of hair, slow pulse rate, slowed metabolism is dash. Myxedema, coma. Chronic condition producing gradual enlargement in hands, feet and bones of head and chest associated with overactivity of anterior lobe of pituitary gland in adult is acromegaly. The major complication of hypothyroidism is dash. Myxedema, coma. Drug of choice for thyroid replacement is levothyroxine sodium. Most common form of hyperthyroidism is dash. Graves' disease. Abnormal protrusion of the eyeball is dash. Exophthalmos. Dash is a potentially fatal acute episode of thyroid overactivity characterized by high fever, severe tachycardia, delirium, dehydration and extreme irritability. Thyroid storm or thyrotoxicosis. Dash is the commonly used antithyroid medication, propylthiouracil. Removal of thyroid gland is dash. Thyroidectomy. A spasm of facial muscles which occurs in tetany found by Chopstick, an Australian surgeon, is dash. Chopstick sign. A sign for tetany in which carpal spasm can be elicited by compressing the upper arm and causing ischemia of nerve distally. Found Troussier, French physician, is dash. Troussier sign. Inflammation of thyroid gland is dash. Thyroiditis. Dash disease leads to an accumulation of copper in the tissue of the liver, brain and kidney. Wilson's disease. Dash is a common condition characterized by neuropathic atrophy and proximal muscle weakness. Myopathy. Hyposecretion of parathyroid gland leads to dash. Hypoparathyroidism. Dash is an inherited form of hypoparathyroidism involving lack of end organ responsiveness to PTH. pseudo-hypoparathyroidism. Dash result from idiopathic atrophy or destruction of adrenal gland by an autoimmune process or disease. Addison's disease. Addison's disease was first described by Dash 1849 Thomas Addison. Dash first described by Harvey Cushing in 1932, resulting from overactivity of adrenal gland with the consequent hypersecretion of glucocorticoids, Cushing syndrome or hypercortisolism. Abnormal fat distribution in which a dorsocervical fat pad appears on neck in patients with Cushing syndrome is called Dash buffalo hump. Most powerful mineral corticoid is Dash aldosterone. Dash refers to hyposecretion of aldosterone resulting from an adrenal lesion which is usually benign. Primary hyperaldosteronism. Dash results from variety of conditions that causes overproduction of aldosterone, which include sodium wasting, renal disease, laxative or diuretic abuse, dehydration, cirrhosis with ascites, heart failure, and decrease in intravascular volume. Secondary hyperaldosteronism. Thanks for watching. PSC NURSEന്റെ വീഡിയോകൾ ഇഷ്ടപ്പെടുന്നവർ ലൈക്ക് ചെയ്യുകയും ഫ്രണ്ട്സിന് ഷെയർ ചെയ്യുകയും ചെയ്യുക. വീഡിയോ കാണുന്നവർ ഈ ചാനൽ സബ്സ്ക്രൈബ് ചെയ്യുക. നിങ്ങളുടെ വിലയേറിയ അഭിപ്രായങ്ങളും നിർദ്ദേശങ്ങളും കമൻറ്റ് ബോക്സിൽ രേഖപ്പെടുത്തുക. വീഡിയോ കാണുന്നവർക്ക് നന്നായി പഠിക്കാൻ ശ്രമിക്കുക. പഠിക്കുന്ന എല്ലാവർക്കും ഞങ്ങൾ വിജയാശംസകൾ നേർന്നുകൊള്ളുന്നു. അടുത്തുള്ള വീഡിയോയിൽ വീണ്ടും കാണാം. നന്ദി, നമസ്കാരം.